Hi and welcome. My name is Dr. Maria, and we're going to be activating the deep core with the pelvic floor. We have built a series that is going to teach the body how to maintain this connection from the diaphragm, deep core, and the pelvic floor, and challenge it with continuous core exercises. So before we get started, I want to actually start with diaphragmatic breathing. This is a really great way to set the body and actually begin the contraction or begin the connection between the diaphragm and the pelvic floor. Basically consider it as a warm-up. So we're gonna lay on our back first. And so this way of breathing is a little bit different than some of other practices such as belly breathing. We're not going to be focusing on drawing the breath in at the belly, but more or less up here at the bottom of the rib cage. So I would like for you to guide your hands just at the bottom of the rib cage, more at the sides. And when you take a breath in, I want you to think about actually breathing outwards into those hands. And this is really going to help the diaphragm, which is the primary muscle breather, activate. And this is the main muscle that should be drawing in breath. So we take a big breath in. If you feel the top of your chest also elevate, as well as some pressure from the back body into the mat, that is absolutely normal. But as we breathe in, we really want to think about drawing that breath outwards. And then on the exhale, we're just going to push the air out of our bodies. We may feel a little bit of a deep core contraction as we push that air out, but that exhale should not be forceful. So we'll do at least 10 breaths. The body is completely relaxed as we begin to warm it up just with this breath of in and out. Let's go for 3 more. Perfect. So now that we've warmed up the body with some diaphragmatic breathing, we're actually going to do a deep core contraction with the breath. Now, oftentimes we describe this sequence of activation a Kegel. And it very much well is a Kegel, but I want to just break it down a little bit of how we actually synchronize all of these muscles together. So the inhale for now should always be when the body is relaxed. We're not contracting any muscles. We breathe still kind of outward into your hands if your hands are at your base of the rib cage, or still think about doing the same thing that you were doing before. And now, as we exhale, we're not just going to think about contracting the core here, but we're going to be thinking about contracting the pelvic floor, which should be right underneath the rib cage here. So this is the pelvis, and the pelvic floor is just at the bottom of the pelvis. I actually have a little bit of a diaphragm. This is the pelvis. This is the pelvic floor. So if I place my pelvis on top of my pelvis, we actually should have this just aligned or stacked underneath of the rib cage. So we don't want to have an arch where we can stick our hands, and we certainly actually don't want to kind of tuck and roll in. If we tuck and roll in or roll down, this is actually going to create a little bit more of puffed up abs and may actually lead into a little bit more of like that doming effect. So we actually just want the pelvis to be nice and relaxed. And we just want to kind of feel that this rib cage is just stacked right underneath of that pelvis. So when we're ready for that exhale, we're actually going to think about contracting this pelvic floor down here. And the best cue to get that pelvic floor contraction, I would say, is 2. You want to think about a blueberry right here. You can see where I'm pointing. This is actually where we want right here, I'm sorry. That is where our vagina opening is. And so these are the lips here, and if we actually have a blueberry right there, we want to actually think about squeezing this pelvic floor around the blueberry. Another good cue would actually be stopping your flow of urine. That helps just kind of connect to what we're doing here. So we're going to take a big breath in as we are relaxed, and then on the exhale, I want you to think about squeezing and lifting upwards as you draw out the air. Nice and relaxed. Squeeze and lift up. Squeeze and lift up. I want you to also take notice. Are you feeling your glutes contract? Do you feel muscles here really try to tense and squeeze? Are your legs shaking? Are you feeling the inner groin contract as you think of squeezing the pelvic floor? As we continue and practice this coordination, we really don't want those big global muscles to contract and overpower the contraction of the pelvic floor. So let's try 3 more. Big breath in, squeeze and lift. So as we advance that, we are going to do the same thing in the same way. That allows us to create a base, if you will. Because when we move into further progression and we're moving the arms or the leg, or if we're standing and doing functional movement, we actually want to squeeze and lift and hold and just set that contraction here. And now while we're squeezing and holding, we can actually breathe. So we try to breathe in and breathe out all the while that you're squeezing the pelvic floor. Now, this is essentially working the pelvic floor in an endurance capacity. So how long can you actually squeeze and maintain the squeeze? Do you feel connected the entire time? Are you still breathing? Make sure you're not holding your breath. We don't want to hold breath anytime we're doing a core exercise. If you feel that you're losing the contraction, you can completely just let go and then do the sequence all over again and completely just let your body set back into that hold and keep breathing. You can actually simply just make this an exercise if you want to give yourself a time count where you're actually trying to hold for at least 10 seconds and then let yourself kind of relax. Go back in again. Can you actually hold it for 10 seconds? The longer you hold, are you feeling more of those bigger muscles, your glutes, your inner groin? Are you feeling more of that superficial core really contract? Do you feel like you have to push your rib cage down and kind of grip from up here just to get that forceful feel of a hold? If you're feeling that, just completely relax everything and then just give yourself at least 30 seconds to a minute to really completely reset, and then see where that contraction is again. Now we're ready to move on with leg movement. There are different progressions, and we'll start with the easiest and move into the hardest. So we're going to breathe and set. So we're going to keep trying to hold. If we need to reset as we're moving, that is completely fine. So as we are here, we're actually going to, this would be great if we actually had a slider. You could just place the slider underneath of your heel. If you have a sock, you can also get a sock too, or if you have like a silk pillowcase, anything that allows the slide to be slippery, because as we're holding, we're actually just going to be sliding the heel down, straighten that leg, and then we're going to come back up. Slide that heel down and then come back up. So let's just go for 5. I'm squeezing and breathing at the same time. And let's just go for 2 more. going to alternate, and I am going to reset here myself. And let's slide out for 5 as well. Perfect. So we'll move right along into the next progression. So same thing, we're going to reset,